Insured by Lovelace, which is no longer accepted at Santa Fe's main hospital. Lovelace estimates as many as 14,000 people will have to fork out a lot more cash to see a doctor at the Christus St. Vincent Regional Medical Center or go someplace else. Crystal Gutierrez is live in the Newsplex.
And Tim, it's a result between a bitter battle between the hospital and the insurance company.
There is no other hospitals here in Santa Fe. This is our hospital.
Jancy Cisneros-Neath has been on the phone all day trying to figure out what she's going to do. Her son is on Medicaid. Lovelace is the health care provider. Her son's primary doctor works at Christus St. Vincent. As of midnight, the contract between Lovelace and Christus was terminated. The Santa Fe hospital is no longer accepting Lovelace insurance.
He can no longer go to his pediatrician anymore.
The two corporations could not reach an agreement over reimbursement funds. Both parties accuse the other of playing unfair.
We were given certain ultimatums by Christus from their corporate office in Houston that we simply couldn't accept.
Lovelace Chief Financial Officer Frank Ulivari says Christus wants to drastically increase the money Lovelace pays out for patient services.
The rate of increase that they were requesting for our HMO PPO members, for example, was a 34% increase over a 3-year period.
Christus St. Vincent CO Alex Valdez says that increase is to cover the amount of money the hospital lost last year when the health care provider decided to decrease reimbursement to the hospital by 22% for Medicaid patients.
And we manage to our budget. And when you see unilateral reductions like this, it affects the way that you conduct your business.
Lovelace members will still be covered for emergency services. Cisneros-Neath says that gives her some relief, but not much.
What's considered an emergency?
Right.
You know, what might be an emergency to me might not be an emergency to them.
And a lot of this stems from the ailing economy when the federal government slashed money for Medicaid and Medicare. Health insurance providers like Lovelace had to swallow the cost or pay less to hospitals. Now, Lovelace did that in 2009. Christus is now trying to recoup some of that lost money. Tim, back to you.
Thank you, Crystal. Both parties are willing to continue negotiations, but for now, they cannot give us a timeline on when an agreement could be met. In the meantime, Lovelace has set up a hotline for its Santa Fe area members. Call 877-727-3050 7 days a week from 8 a.m. to 5 p.m. Lots